St. Peter's has long been a leader in cardiovascular care. With our new cardiac and vascular surgery facilities just off of Main Street on the first floor of the pavilion, St. Peter's doctors and staff are able to maximize efficiency and bring the best quality of care to patients. The new cardiac and vascular surgery facilities provide greater comfort, convenience, and privacy for patients and their families. Among the new patient care areas and innovative technology is the hospital's $2.4 million hybrid operating room, a new life-saving, high-tech cardiovascular surgical suite.
This new area is one of the nation's most advanced facilities for surgery and post-surgical care of patients with complex heart and vascular disease.
The hybrid OR is a true hybrid OR, equipped with all the devices necessary to perform both advanced cardiac and vascular surgeries, as well as interventional cardiology and vascular procedures. All imaging, anesthesia, and surgical equipment is mounted into the ceiling, creating an open and spacious environment. A nursing command center located within the OR allows the surgical team to view and transfer all images, vital signs, and patient data to any flat panel monitor within the hybrid OR, including 4 flat panel displays on movable arms, 6 flat panel displays on the monitoring boom, and a 42-inch flat panel mounted on the wall. These monitors provide surgeons with better quality, high-definition images to work with. Because the hybrid OR is a fully equipped surgical suite, there is no need to relocate the patient or bring in a new surgical team. Surgeons can instantly convert from a minimally invasive procedure to an open surgical procedure in an emergency. The ability to stay in the same room decreases the risk of infection and complications from surgery for the patient. This change means physicians and staff adjust the room to the needs of the patient, and the patient remains in the room. The previous cardiac procedural rooms meant unhooking tubes, machines, and monitors, and then moving the patient to the right type of room due to a change in patient status.
Well, considering where we started and how far the technology has progressed over the last 20 years, it's incredible. It's an exciting opportunity. I think it offers, cutting-edge medicine to our patients. It enables us to collaborate as physicians on newer technologies, and we wouldn't be able to do that without this type of a situation.
The largest feature of the hybrid OR is this huge 25-foot robotic arm called the Artis Zigo. The C-shaped 3D imaging system can be turned 360 degrees, positioned at virtually any angle, and it produces high-resolution images of the heart and vascular system that help surgeons with pinpoint accuracy. This multi-access system is one of only 29 in the world and will accommodate techniques being developed for the future.
I think the system here is very exciting. I think the image quality that produces is amazing. The ability to do a CAT scan right on the table as you're doing something is amazing. And just to see the result of what you're going to complete is, as soon as you finish it, rather than sending somebody somewhere else off to get another picture done, I think that's going to be a big asset.
In addition to the hybrid OR, this new center will have a total of 8 state-of-the-art operating rooms. It will house 33 patient beds in 4 distinct units, an 8-bed surgery preparation holding unit, a 4-bed post-anesthesia care unit, an 8-bed cardiac and vascular intensive care unit, and a 13-bed progressive care unit. Each room is appointed with large windows providing more natural light, conducive to rest and recovery.
The patient will enter through the cardiovascular pre-op area and be greeted by our cardiovascular nurse navigator and a cardiovascular anesthesiologist. The patient will then be brought into one of our 4 cardiac and vascular operating rooms. They were all equipped with OR integration systems, state-of-the-art monitoring.
Post-surgery, patients will be moved to the 8-bed cardiac and intensive care unit, where they will remain for 2 to 3 days before moving down to the 13-bed progressive care unit. This ballroom-like space is designed to include acuity-adaptable patient rooms with a centralized monitoring station, replete with a closed-circuit television camera in each patient room for 24/7 observation.
The patient will be seen by our nurses and physicians here and our discharge planner who is dedicated to this area. And you can see that it's a seamless transition of care throughout the entire first floor Pavilion Cardiac and Vascular Center.
Spacious waiting rooms, including the Egan Family Lounge, are available in the cardiovascular surgery area. For families preferring more privacy, waiting rooms for families of patients undergoing surgery is separate from the main waiting area. Workstations are located nearby all waiting rooms for those who need internet access.
Using such futuristic operating rooms and other technologies, these new facilities will allow teams of multidisciplinary specialists to perform today's procedures and will accommodate techniques being developed for the future.
St. Peter's Cardiovascular program has been commended numerous times for its services and the extensive quality of its care. With the new technology and services provided in the Cardiac and Vascular Surgery Unit, St. Peter's doctors and staff are more ready than ever before to provide the best cardiovascular care for the residents of the Capital Region and beyond. Thank you for visiting St. Peter's Cardiovascular Surgery facilities located on the first floor of the new Patient Care Pavilion. These new cardiac and vascular surgery facilities house one of the nation's most sophisticated arrays of diagnostic, surgical, and critical care technology. It positions St. Peter's to be the leader in cardiac and vascular surgery today and in the future. Most importantly, it is all here for one reason: to support critically ill patients whose very lives depend on the care they receive moment to moment.